Tell me a little bit more about this new cutting edge and non-invasive diagnostic testing, what it is and how you're using it at Compass Fat Loss.
Sure. So it really is cutting edge. It's a brand new technology. It takes about 20 minutes and it gives us a really good overall global view of a patient's risk factors for things like cardiovascular disease, sudden death, hypertension, diabetes and neuropathy, inflammatory conditions, stuff that we really never had such a deep dive into before with such a concise, easy test for a patient.
What Dr. Kusher is implementing is a very good screening technique to figure out which patients may be at increased risk of cardiovascular disease down the road. And what we're able to do is partner the Center for the Healthy Heart here and Dr. Kusher with Compass Fat Loss to determine which patients are at risk and employ all modalities to discover that risk and mitigate that risk.
No matter what we find in these tests, they're not things that happened overnight. So these are cumulative issues that have finally caught up with the patient. And this is the way that we can instill these lifestyle changes in as permanent changes. So when the patient reaches their goal weight and we finally let them fly on their own, they've got all the tools to maintain that weight for the rest of their life within a very tight range, with the knowledge that they can always come back and turn to us if they need some future guidance.
And Dr. Thompson, talk about how maybe your continued role in this process, maybe it makes people who are participating feel more at ease knowing that there's a lot of eyes going into the type of program and care that they're getting.
Absolutely. Part of the misunderstanding about cardiovascular disease is that patients have symptoms. Many, if not half of patients might not have any symptoms whatsoever. Well, I think it's important to understand that the state-of-the-art cardiovascular evaluation and management can be done here locally. We've incorporated many techniques from Cleveland Clinic, Mayo Clinic, which is, these are two of the most prestigious institutions in the world.
There is no quick fix. So there's no magic pill. There's no foods and shakes and bars that's going to get you to lose weight that you're going to wind up keeping off long term. You need to have a program that helps you institute permanent lifestyle changes that you can build into the way that you live every day.
And does Compass Fat Loss accept all types of insurance?
Yes, this is something fairly recent, Taylor. We do accept insurance now. The other thing, Taylor, that I think is really critical to know is that, if a patient wants to come in for this scan, that's virtually the only thing that they need to show up at the office for, because our program is now 100% virtual. So everything that we used to carry out in all of our brick and mortar locations has now been migrated to an online platform. It's a 100% data-driven program, so we don't guess at anything. We have people getting on their scale at home. That data is transmitted to us. We follow numbers every single day, so there's no room for guessing.